it's interesting to see how much power people believe that we have that we really don't have. We control what we control, and we don't control what we don't control. And so what's happening at the schools with the athletics, we've had conversations with the governor. The governor makes those decisions. We've had conversations about what happens at our airports. Sometimes we agree, sometimes we disagree as mayors talking to the governor. The governor sometimes will go with us. Sometimes we'll all be together and decisions being made. Sometimes we're not. So the rules that people believe that the mayor can make or believe that the council can make, sometimes we have no control. I heard a lot on the medications. Why aren't you mandating doctors to prescribe ivermectin? As council members, you know that you don't have that power. I don't have that power. The governor doesn't have that power. But let me just share with you what I've been seeing. Yesterday and today, I visited both the Hilo Hospital and the Kona Hospital. At the Hilo Hospital, I got a chance to talk to their emergency physicians. And one of the questions I asked of one of the emergency physicians was, are you using ivermectin? I have a lot of these people telling me that they can't use it. They said, we use everything we can. And so I went back to this whole thing on ivermectin. How effective is it? It's like everything else. It can be, and a lot of times it's not. They use a bunch of different drugs that are available to them. But I know a lot of people think that you just treat them with ivermectin and they're done. That's really not the case. What the hospital is seeing is that people who are most likely to be put in the hospital are people who aren't vaccinated. I know a lot of these people we just heard from don't want to hear that, but it's somewhere around 97%. 100% of the people in Kona Hospital right now are unvaccinated. 100%. And talking to Hilo Hospital yesterday, what they're saying is that people who are unvaccinated and come down with COVID are on the average spending about 4 weeks in the hospital. People who get COVID and have been vaccinated, maybe 6 to 7 days, and generally those people have other things going on with them. We're looking at what we're seeing, and what we're seeing is right now our numbers are skyrocketing. And it's a shame because we have, as a county, have been doing, I think, a great job. And I'm not talking about the government, I'm talking about the community on the Big Island. Our county had been doing a great job up until recently, but we started to let down our guards. I let down my guard. I think all of you probably have let down your guard. It's not a time to be pointing fingers and assessing blame. It's time to say, wake up. We know that we have an issue. We need to come together as a community and start, doing the right things. Stop, maybe some of the gatherings. And I know people some of those people just testified, wear your mask. We know that this is something that is spread, especially in close contact. So when you're out in public, wear your mask. When you're in places, stop the gatherings. We've had too many large gatherings where we've let down their guards. And, again, I'm not pointing fingers because I've been to some of those things. And I think all of us have. We need to take responsibility as a community and work on this. So what rules have we been putting down? Well, most of the rules, as of last year, the governor took the mayor's ability to make their own rules kind of away. We suggest rules, we make our proclamations. Those proclamations go to the governor. The governor either approves them or recommends changes. So we are looking at making some rule changes, especially with what we're seeing. What we're seeing right now is we're on fire. Our hospitals are in trouble. In both the Hilo and Kona hospitals, we have more people in ICU, in our ICU, our intensive care unit, in beds there than with COVID than not with COVID in the ICU. In Hilo Hospital the other day, they told me they had someone waiting for 2 days in the emergency room because they couldn't get them into an ICU room. That's scary. If we were to have a disaster, even a minor disaster, major car crash, a storm, we have a hurricane bearing down, hopefully this is going to miss us, but if we needed to use our hospitals, not just Hilo Hospital, not just Kona Community Hospital, the whole state is in trouble. Yesterday, we had 36 FEMA nurses, or 38 FEMA nurses, excuse me, start working at Kona Community Hospital. That is not a good situation. So what are we looking at? We're looking at how we can pull back some of our rules so we don't have to shut our community down. I don't think anybody wants to shut our community down. So we are looking at possibly doing a little bit more enforcement, changing our way of enforcement. We've been looking at arrests. We're probably going to go to citations and start, looking at issuing a lot more citations when people aren't following the current rules that we have. We went from a shall to a should with a lot of our restrictions. For example, with what happens in our stores, with having, people clean and spray and stuff like that. Those are probably going to be shoulds. We're looking at the places where people congregate and have been over-congregating, which could be our parks and beaches, and possibly putting a pause for a couple of weeks there. There's a couple of other small changes that we're looking at, but most of the changes that are being made at the governor's level because that's where the authority lies. The schools, that's with the governor. The hospitals, the medicines, that's with the federal government. So just remember, there's things that we can do, things we can't do. As far as mandates, we have not mandated testing. The governor's rule says that county or state officials either be vaccinated or get tested. So if you want to say that something's been mandated, testing's been mandated. I don't think anybody has died from testing. I'll leave with this, and I started with this. We are in a crisis situation, but 90% of the counties in America are in a crisis situation. We know what needs to be done. We need to act responsibly. All of us, including you and me. And that's how we get out of this. So I thank you for your time. I thank you for, the people that testified. I know that, you may not agree with me. I heard some some things about, religion and biblical sayings. One of the biblical sayings I live with is be bold and courageous. And, I'm a big believer in God, and God tells me be bold and courageous, and even make those decisions that a lot of people don't agree with because you believe it's the right thing to do. I think all of us are trying to do the best we can. I heard that from the hospital today, the nurses who are tired, who are worn down, they're saying the message that they would like to get out is they're doing the best they can, and they just want the community to do the best they can. So thank you very much. I have Stephen Talmadge. I don't know if there's any big questions. My 10 o'clock's been waiting for a half an hour though, so.
Oh yeah, real fast, Mayor. So I just want to make sure, because the whole purpose of this was to get information out. This was your opportunity, right? Okay, so there's going to be stepped up enforcement, no arrests, but citations.
We're looking at changing our rules to allow for citations, to make it easier on the police, because part of the problem is you don't want to arrest people and put the whole cell block and everybody else in danger.
Okay. And then places where people congregate or gather, there's going to be some new rules regarding that? Or
we're looking at that right now.
Okay, you wouldn't be able to give us an idea of what you're thinking of?
Well, we're looking at closing some of those places, some of our parks and beaches where people congregate.
Okay, but in terms of the numbers, that's going to be with the governor. You're going to stick with what the governor is saying. Nothing specific for this island then?
No, that the governor's has that. And if we close the beach parks and stuff like that, we'd still allow people to surf and to exercise in the water. We're just not going to have people congregating like they have been.
Okay, and I don't have any more questions, but if other members of this body have questions for Talmadge or Steve.
They're online.
Right, and they have authority to speak on your behalf on matters, right?
That is
for
correct.
Sure.
And Betsy Strands, who is our Corp Counsel, who's here with us, she's actually heading up our COVID Rules Committee. So she's probably even got a better idea of what we're talking about. And
well, as I said, it was intended to be a short discussion, and I think you've answered most of it. I don't know how much more other people can answer, but I wanted to really thank you, though, Mitch, for being here. And I know you came under some criticism by some of the speakers who didn't know that you were sitting in the audience, but thank you so much for coming. And I want to, apologize to my colleagues. I didn't anticipate this becoming a platform for, I'm just going to say it, for the anti-vaccine community. And that's what it became. And that's okay, because I believe that every bit of information or testimony has some educational or revealing value to it, so it's good. And I got a call from one of those guys who testified today. He's a friend of mine, and he told me why and what the impetus were, where they got the information to come forward. It was an organized, a concerted effort, and that's all right too. But thank you so much. Yeah, appreciate it.
And I appreciate that. I hope you realize that not everything that you hear over these things are true. Aaron's never invited me, and I've never been to his house, so.
Thank you. Thank you very much, Mayor.
Villegas, yes.
Thank you, Ms. Villegas.
I just have a quick question. Mayor, thank you for helping to clarify our sphere of authority and influence in the different roles that we all hold, whether that be on the council or as the mayor of the county. Being the representative of District 7, what's coming to my ears most often are questions about Ironman and it being a major event hosted in the center of town with thousands of people, and people's concerns about that. So my quick question to you, because I have been trying to gather the information from different sources, but do you then Does the decision for whether or not Ironman happens reside with you and your office?
It ultimately resides with me, and I have to tell you that we're struggling with Ironman. We're having a conversation with them today, and at this point, because of what's happening, unfortunately, it does not look very positive for the Ironman this year. We had a Honu, which is the half Ironman, which was very successfully done.
But very different.
They've had a lot of really great protocols to make sure that everybody was safe in that. The issue with the Ironman, quite frankly, is what do you do about all the people coming to spectate? And to this point, I have not heard a plan that would make me feel safe for this community. I would love to see the Ironman happen, and I also realize that it's something that helps our community, but it's
The
also
risk
something that
outweighs
could
the
be
reward.
a major cause of the spread. So.
Thank you. I just wanted to clarify where that decision lies. Might just have one more quick question, and that is, does the decision to reinstate testing at our airports for visitors, does that decision reside with your office?
No. Yes and no. Governor still has to approve. And so we actually have a request before the governor, and assuming that we can find the funding, and we're talking to some people that may be willing to help us do that, to allow for what they're doing now in San Francisco Airport, which is a self-test kit. You get the kit when you're off. We ask you to test and then get the results. There's pros and cons of doing that. Of course, the state and county doesn't necessarily find out, or may not find out, who those people are, which skews up numbers and may prevent things like, tracing and stuff like that. On the other side of that, if you have it, we ask you so we haven't got the okay on that, but with the numbers of people coming to the airport, it makes it difficult for the airports as well to do that.
Yeah, and I hear a lot of people frustrated as residents feel they're being punished and kind of to blame for the community spread, but their frustration is the introduction, and it's just tragic the way a lot of these things have lined up. But I just wanted to clarify with you where there was a potential way to identify areas of responsibility and decisions being made. So thank you for helping to clarify that for those two things. Appreciate it.
Mahalo, Ms. Villegas. Mr. Corneli E. Kleinfelder.
Thank you, Chair. Mr. Mayor, mahalo for being here today, as well as having some of your staff here for our questions. With the testimony we heard this morning, I think for you specifically, I have a lot of questions in general, but as your time is short, Shannon Matson said it very well. Like, if we're going to require testing or vaccination mandates or testing mandates, however you want to look at it, and the case numbers that we're seeing across the state, with the Big Island being second highest in our state as far as cases, are we going to be standing up more testing sites as we require state and county workers, which is probably the largest workforce in the county or the state, to be tested, as well as to handle our residents who are increasingly becoming more concerned with the coupling of schools opening? Are we standing up more testing sites? Are we increasing our staffing for those testing sites? And how are we going to accomplish this?
So great question. Thank you for asking that one. We are working on setting up more testing sites. If you guys can hear me a little bit better with this down. We're also asking Department of Health and Department of Education. Department of Education, Department of Health actually have a plan on doing that moving forward. We're also trying to hire people as we sit here and as we speak. The issue, and this goes back to Ms. Villegas's question as well, the issue with testing is the issue for just about every other business, not just in our county and our state, but now across the country. It's finding people to man or staff those testing sites. And so Department of Education has some plans for the self-test kits for the kids. They're also looking at places like CVC pharmacies and setting those up. We're looking at setting up more testing sites, not just in Hilo and Kona, but also Waimea, and trying to get out to Ka'u. It is, the how is a little bit difficult, but we're trying to work with all of our resources together. Got to give a special shout out to KTA, who applied for and got a FEMA grant through the state. And so KTA was actually forward standing, and before they actually had the money, they started going out and they've started taking on a lot of the testing responsibility. So it is something that we are working on very diligently now, and we have a regular meeting with Civil Defense, Department of Health, and others, our schools, discussing these issues. All right.
Okay.